Good evening and welcome to the COVID-19 update on Channels Television. First, the highlights. Northeast Development Commission donates edible and non-food items to get people back on their feet in Taraba State. The United Arab Emirates eases restrictions after recording less than 100 new infections a day for 2 weeks. Thank you for joining us. I'm Millicent Nwonka. The International Monetary Fund, IMF, says that Nigerian banks closed 234 branches and 649 automated teller machines, ATMs, in 2020 amid the COVID-19 outbreak. The IMF, in its 2021 Financial Access Survey, FAS, released on Monday, said the number of ATM points in Nigeria fell by 649 to 18,810 in 2020 from 19,459 in 2019. The report further stated that the number of commercial bank branches in the country reduced by 234 to 5,158 in 2020 from 5,392 in 2019. The 2021 round offers a glimpse of what has happened during the pandemic on the financial access front. The survey takes place in the second year of the COVID-19 pandemic, collecting data on access to and use of financial services amid the crisis. Meanwhile, the Nigeria Center for Disease Control, NCDC, confirmed 90 COVID-19 cases across 7 states and the Federal Capital Territory. Here's more on the virus update.
2 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and the FCT and indicate a rise from the figures reported 24 hours earlier. Lagos is in the lead again with 33 new infections. The FCT and Nasarawa states reported 15 and 14 cases, while Cross River and Rivers had 11 cases each. Kano, Bayelsa and Kaduna reported 3, 2 and 1 infections in that order. This report includes backlogs of confirmed cases from Lagos State. No cases were reported in 4 states, Delta, Edo, Plateau and Sokoto. The total caseload in Nigeria has risen to 212,051. 217 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 203,338. There were 2 additional deaths from COVID-19 complications reported in the last 24 hours, raising the total number to 2,898. Currently, there are more than 5,600 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.6 million Nigerians have received a first shot of the COVID-19 vaccine, while over 3 million persons have been fully vaccinated. Globally, more than 7 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 218,000 deaths recorded across countries on the continent. More than 247 million people all over the world have contracted COVID-19, while deaths are over 5 million.
In an effort to ensure the residents of the Northeast region have what it takes to absorb the shocks of the coronavirus pandemic, the Northeast Development Commission has donated food and non-food items to the Taraba State government for onward distribution to vulnerable residents across the state. This is coming after the Commission donated a fully equipped COVID-19 laboratory to help in the testing and screening of residents there. The donation by the Commission is also to mitigate the effects of the over 10 years of insecurity in the Northeast.
Flattening the curve of the COVID-19 pandemic in Nigeria has been the target of both state and federal government for citizens to return to how things were instead of the new normal. The Northeast Development Commission is one of those that has been on the forefront against the existence of the ailment in Nigeria, particularly in the northeastern region of the country. One of such efforts is the establishment of a fully equipped COVID-19 laboratory and donation of personal protective gear across the region for diagnostic purposes, as well as donation of food and non-food items to cushion the effects of COVID-19 on all facets of human endeavors, especially agriculture and insecurity, which necessitated this gathering.
We have the COVID lab here, and we say we're even going to upgrade it so that should in case any emergency came up in the future, we're able to tackle it. Not only COVID, but any kind of infectious diseases. And as this now, we are looking at how we can be able to intervene should in case if the need arises in terms of educating people, in terms of providing some palliative to keep people safe.
The state governor, Darius Ishaku, who appears overwhelmed, says the testing machines can also be used to detect other diseases.
Now we have a brand new, not one COVID testing points, but two. The one they donated, the one we erected, and they have also improved on it. They can test for hepatitis, they can test for TB, they can test for HIV and other tests. So it's doing very well. It's a brand new and we're using it maximally.
The Northeast Development Commission has also been intervening in ICT training to mitigate the knowledge gap occasioned by lockdowns, and is believed that its interventions will go a long way in bringing the state back from where both the COVID-19 pandemic and insecurity left it.
The Ogun State government has launched a mass vaccination campaign against the COVID-19 pandemic to bring to the fore the much-needed awareness among residents of the state as it targets 2 million residents for its mass vaccination drive. At an event held at the arcade ground of the governor's office in Abeokuta, the state capital, the governor, Dakwa Abiodun, launched the exercise set to run until December 25, 2021.
So far, Ogun is among the 10 most affected states with COVID-19, having over 5,000 confirmed cases of the virus, 80 deaths, while 149,373 residents, representing 40% of the eligible residents, have been fully vaccinated. To mitigate further spread and to communicate the much-needed enlightenment on the pandemic, this gathering, which includes market women, opinion leaders, youth, and other agents of mobilization, are present to witness the mass vaccination campaign.
You're most welcome.
Under this program, about 2 million residents, which represent 40% of the population eligible to receive vaccines, are being targeted as the state increases vaccination camps across the 20 local government area of the state.
We are establishing mass vaccination camps in strategic locations across the 20 LGAs mapped out by the GIS.
The Executive Secretary of the National Primary Health Care Development Agency, Dr. Faisal Shuaib, who commended the state government for the political will, also assured residents of the federal government's resolve to have 50% of eligible Nigerians under vaccination cover in 2022.
Let me assure all Nigerians again that the federal government remains committed to the provision of safe and efficacious COVID-19 vaccines in the country, backed with accountability and transparency.
Governor Dakwa Abiodun explains the urgency for the exercise.
We are going to give a window to allow for this vaccine. And that window starts from today for the next 60 days. Anybody after 60 days that is not vaccinated will not be allowed in our offices, will not be allowed in our schools, will not be allowed to do business with us. We will do spot checks in our markets. You'll be required to carry your vaccine card with you at all times.
Conveners of the program explained to residents that even though the vaccine is necessary for prevention, it cannot take the place of non-pharmaceutical measures such as mask wearing and proper hand washing.
Well, away from the vaccinations and vaccination mandates, the Nigeria Center for Disease Control, NCDC, is the National Public Health Institute with a mandate to lead the preparedness, detection and response to infectious disease outbreaks and public health emergencies. with a vision to lead a healthier and safe Nigeria through the prevention and control of diseases of public health importance. We look at the agency, and this is under the new leadership of Dr. Ifedayo Adetifa, that's the new DG of the NCDC. And joining us to talk about this is Professor Yuwale Tomori, a professor of virology. I'd like to thank you for joining us on the program.
It's my pleasure, always.
First, the NCDC as an institution in fulfilling its mandate to prevent, detect, respond to infectious disease outbreak, has it, would you say, successfully done so?
I think within the context of Nigeria, yes, it has. Working in Nigeria is not an easy thing. And for them to have achieved what they've achieved, I think it's kudos to them. They've done very well. I believe that they could have done better if they have gotten the kind of cooperation they needed from the state government and all other agencies involved.
Perhaps we'll come back to a few of the things you've mentioned, but then what would you say Dr. Adetifa is up against as DG NCDC?
I think the NCDC has to move away from being the center of everything. It should become a coordinating center as distinct from being a center. Because you can't run around helter-skelter all over the 36 states of Nigeria when everybody depends on you. We must decentralize and give that ability to control and prevent disease to the state level. Then the NCDC becomes a coordinating center, not one that runs helter-skelter and answers all the 36 states. We were doing that before. States were taking care of some of this. And the federal at that time was just a coordinating position. They're in a better position to do that. And I think the new director must look forward to that, to turn it into a coordinating center rather than just the focus of all of the activities for disease prevention in Nigeria. We must strengthen our states. Lagos State is doing that, and it's probably the only state that is doing that. We need more of our states to take responsibility for preventing and controlling disease in their locality.
But that might be difficult. I mean, I've spoken to a number of NCDC officials who have said, I mean, when there's an outbreak at the subnational level, there's a responsibility of the states, the actors, the public health there to actually wade in as they are more on ground and then perhaps involve the NCDC a little later on. So they've always had that challenge. So is it a thing of sensitization, education? How do they make this coordination, integration to help public health emergencies?
You know, NCDC can't be different from Nigeria. The whole Nigeria structure is federally centered. Everybody goes to Abuja to go and collect money and other things. So NCDC can't be different. Therefore, it is a national change in which at the state level, we take care of our problems and decentralize and let the focus on federal be out of it. So that's the same thing that has to happen. I mean, you remember even health is on the concurrent list. Then the states should take care of the concurrent aspect of health and do that, not everybody running to this thing. Take the issue of data, for example. Part of the problems that NCDC had was the fact that the states were not providing the data they required. You remember when we started, they were saying something about we had only 2 or 3 labs that could function in the country. And then NCDC had to build that up to about 140. But then go and check what is happening right now. You saw the data. Only 1/3 of states are reporting. I heard some state governments saying they're building new labs. Of the ones that we have, check NCDC data. 40, 50 laboratories are not reporting. And so all the so-called 140 we have, what is happening to them? The states have abandoned their role and still depending on NCDC. So we need to get those laboratories functioning. Otherwise, when the next epidemic comes, these labs will no longer function. And then we start all again and say, oh, when this epidemic came, Nigeria had only 2 labs. We must move on. We can't be going back and forth, as we're doing right now.
And if we were to center this to the coronavirus pandemic response, what would you expect should be his prime concern, especially looking at the numbers and looking at the global angle as well to the pandemic?
Thank you very much. I think the foundation is what is important. I mean, like I mentioned, it should be able to get the NCDC away from being the be-all and all of it. I use the word coordinating center. That's what it needs to do, to make sure that, they provide assistance to states when needed. But the state, just like one of their own people said, that basic activity, they are right on ground. So it should make sure that the NCDC becomes that central thing. Let me give you one good example. You remember when some people like the monkeypox got out of Nigeria some times ago? It was like a PHC that detected it. The only time they called the American CDC was when it involved people traveling outside of the country. The diagnosis, the detection, the treatment was done at the PHC level in the US. And that's why CDC can do what it's able to do, because it can then do other things. So Dr. Dedifa must make sure that, you know, the states are strengthened, the labs, the PID and public health are put in right place so that they can focus more on the general national thing.
Professor Iwadi Tomori, Professor of Virology, many thanks. Always a pleasure having you join us on the program.
It's my pleasure. Thank you.
Still ahead on the program, the UAE gives the green light for Pfizer vaccine administration to children from 5 to 11-year-olds. Please stay with us. The United Arab Emirates continues a streak of daily infections below 100 per day as government announces 78 new cases of COVID infections which were recorded last night. The country's National Emergency Crisis and Disaster Management Authority also announced a total of 21,172,758 doses of COVID vaccines have been administered in the country so far. Residents and tourists alike say this has boosted their confidence, particularly as the World Expo is ongoing and continues to attract visitors daily. Our correspondent Maiwa Diguke tells us more.
UAE is fast returning to normalcy, but government says wearing of face masks remain important alongside other precautions. Event season is back in full swing with the Expo 2020 and several other events holding across the country.
I feel so safe because everyone is taking precaution. People have masks and they are vaccinated. So I worry not.
Number of daily new infections have been below 100 in the last 2 weeks, a feat the government credits to the commitment of the people and its vaccination campaign.
I think now that the majority of people are getting vaccinated and like you enter Dubai, you need to have the PCR test. I think it's time that the country can open up a bit more and like people can have this exchange, because I think it was really missing the last years.
In a fresh ease on restrictions, local authority says more guests will now be allowed in weddings and other events held at home. 80% capacity of not more than 60 individuals are allowed to attend provided they have been vaccinated and they meet the Green Pass requirement through the dedicated COVID app. Attendees must also present a negative PCR test taken in 48 hours before the date of event.
I can't be more appreciated for everything happened during this crisis and their efforts, their great efforts to control it. There is mistakes, but we learn from mistakes. We can admit that there is mistakes. We learn from mistakes, and we also, alhamdulillah, achieved a great success, especially when you see this happen, and all the people come and feel safe, alhamdulillah.
Although roughly 88% of the overall population has been fully vaccinated, residents who took other vaccines aside Pfizer are encouraged to take booster shots to strengthen their immunity. From Dubai in the United Arab Emirates, Maiwa Diguke for Channels Television News.
And Maiwa, who packaged that report, is joining us from Dubai. Hi, Maiwa. I mean, it's looking like there's almost no COVID in the UAE. Over 21 million vaccine doses administered so far. How much more to go, and especially how this, applies to visitors to the country?
Millicent, I must say that you're almost right. It does feel like COVID is gone. And I think that government is trying to make sure people don't get carried away by the low cases that we have and make sure that people are still following the protocol, because that's the only way the country can return fully to normal. So that's the situation that we find ourselves in. Roughly 88% fully vaccinated, about 12% to go. And I'm sure that in the next couple of months, the UAE will hit the mark, because, they're really looking to get back fully into normalcy and pre-COVID times. The question now is how soon the UAE would announce that we don't have to wear masks anymore. I'm sure it's still some time to go, but that's on a lot of people's minds.
Tell us more about the Green Pass requirements and how is the government monitoring events, venue capacities to ensure that they are complying to the existing restrictions?
So the Green Pass is found on the app. So there's the app, the Al Hosn app, which is one of the apps we have in the country. Residents should have it, tourists as well, because when you come in as a tourist, you're given a unique identification number that's linked to the app as well. And this monitors all your COVID activities. For instance, when you do a PCR test, when you've been vaccinated, all of that is documented on the app. So when the app shows that it shows green, it means that you're good to go, really. And that's what the Green Pass means.
Also, perhaps away from that, it seems the UAE prefers the Pfizer vaccines to all the others. Tell us a bit more about that.
Well, that's not an official position, at least it's not been officially stated, but we have noticed that with the people and even the system, that there is some level of preference for the Pfizer vaccine. For instance, people who took a double shot of Sinopharm, for instance, are being asked to take booster shots. Of course, you will have to get checked and evaluated, but people are being encouraged to come back for booster shots, and most of them are Pfizer shots. So that's not an official position, but we have noticed that preference.
What are reactions on Pfizer being approved for children from ages 5 to 11 in the country?
With the UAE, I think we've had an interesting dynamic in the sense that a lot of people do trust the government. So you see this huge level of trust that people have for the government, and they, feel like, if the government has checked this, they've made sure that it's good. For some people, they're saying, okay, that's good enough for them. And there's still some people, because we've interacted with a few parents, for instance, who say, if I don't have to, I wouldn't. So you still have people who are deciding not to go ahead in vaccinating their children, for instance. But overall, there's a lot of acceptance and willingness to cooperate with the government.
But it's not official that there are perhaps vaccine mandates, for example?
No.
All right, Maiwa Degoke, always a pleasure. Thanks for joining us, and take care.
Thanks, Millicent.
Let's look at the global update. Russia's daily COVID-19 death toll is at a record 1,178 as non-working days continue. We understand that Moscow's shops, schools, restaurants are closed until November the 7th in a bid to stop the surge of COVID-19 and also deaths. EU is expecting countries, including Russia, to check and investigate the sale of fake COVID-19 certificates. Well, here's more on the global update.
As the resurgence of COVID-19 pandemic burns through the rural U.S. state of Idaho, health officials say they don't have enough tests to track the disease's spread or sufficient medical workers to help the sick. The state's Republican-led legislature this year voted down $40 million in federal aid available for COVID-19 testing in schools. Another $1.8 billion in pandemic-related federal assistance is sitting idle in the state treasury, waiting for lawmakers to deploy it. Idaho's experience illustrates how political ideology and polarization around the COVID-19 pandemic have played a role in the decision of mostly conservative states to reject some federal funding. In the city of Rexburg in the eastern part of the state, healthcare workers at Madison Memorial Hospital struggle to treat unvaccinated patients. Russia's daily COVID-19 death toll rose to a record high of 1,178 amid a surge that has forced officials to reimpose a partial lockdown nationwide. The government coronavirus task force reported 39,000 new infections in the last 24 hours, including 5,736 in Moscow. President Vladimir Putin says Russia may need the army's help to build field hospitals for COVID-19 patients as Russia battles a surge in infections. Mr. Putin last month ordered a week-long nationwide workplace shutdown from October 30th that could be extended by regional authorities as they saw fit. And China is conducting mass nucleic acid testing and implementing strict anti-pandemic measures in crowded public areas to stem infections following sporadic outbreaks which have occurred in some provinces. A batch of movable cabin labs for rapid nucleic acid testing were set up in East China's Jiangxi province, which are capable of testing about 380,000 people a day. The 7th mass nucleic acid testing started in Haihei city of northeast China's Heilongjiang province. Staff of local residential communities informed residents of testing times via online and offline methods to avoid large gatherings.
Adherence to all non-pharmaceutical preventive measures of COVID-19 will help to curb the spread of the pandemic. Continue to take responsibility. You can take a closer look at our website. It's channelstv.com. We have the latest breaking stories and a better understanding of the pandemic with our stories there on coronavirus updates. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.